Hello everyone, I am Dr. Sahithi Balmuri, consultant obstetrician, gynecologist and laparoscopic surgeon at KIMS Hospitals, Gachibowli. Today let's talk about intermenstrual bleeding. Intermenstrual bleeding is nothing but periods in between your periods. That is when you're bleeding in between your two periods. It is absolutely not normal to have bleeding in between your periods. Well, there can be many physiological or pathological causes of intermenstrual bleeding. Physiological causes can be due to physiological hormonal fluctuations that occur during the ovulatory phase. So it can happen as an ovulation spotting. It can happen prior to menopause. In certain women, prior to menopause, they may experience intermenstrual bleeding. It can also happen in early pregnancy as an implantation bleeding. Well, there are certain pathological conditions like infections. Infections of the vagina, vulva or cervix can also cause intermenstrual bleeding. Trauma to the vagina can also cause intermenstrual spotting. Sometimes conditions like endometrial polyps can also cause intermenstrual bleeding. Intermenstrual bleeding can be due to hormonal contraceptive pill usage. Women who are on oral hormonal contraceptive pills can also experience intermenstrual spotting on and off. Women who are on copper T can also experience intermenstrual bleeding. Sometimes it can be due to certain serious pathological conditions like cancers. Cervix of the cancer and the endometrium can also cause intermenstrual bleeding. So it is very important that you do not ignore the symptom and you consult a gynecologist when you experience this symptom, who will first perform bimanual examination, that is a local examination of the vagina, vulva and the cervix. A pap smear may be required to see the condition of the cervix, and ultrasound may also be required to rule out certain conditions. It is always better to get evaluated when you have any of these symptoms so that you do not experience any problems further on. Thank you.